Hi everyone, this is your host Ariadna Maso, and this is another episode of Sano Health Podcast. Sano is bringing you this podcast as we support patient management for clinics and also in clinical studies. And as you know, one of the main pillars that we support is gut conditions. And today we're going to talk about irritable bowel syndrome with one of the most knowledgeable persons I know in this space. Our guest today, I have been following her for a while. She's amazing, and her name is Kirsten Jackson, the consultant IBS dietitian who has been practicing for over 13 years. Her original interest in IBS was sparked after getting the condition herself. And she previously worked as a lead dietitian for King's College Hospital in Dubai, is an official media spokesperson for the BDA, and also an expert advisor to the IBS Network and Forbes Health. Kirsten recently launched her book, Take Control of Your IBS, a step-by-step guide that works. And I recently read it as an IBS and colitis sufferer myself. This was extremely helpful, so I would encourage that you check it out. But all right, well, let's just go for it, and let's get started to talk about irritable bowel syndrome. Let's go. Well, Kirsten, welcome to the show. I'm so excited to have you here.
Thank you for having me. I can't wait to talk about this IBS topic.
So for our audience, they should know that it's been already, I think, 4 years, Kirsten, since I've been following you. You provide really good evidence-based advice, specifically in IBS, and it's something really close to my heart. I'm still struggling with it every now and then, quite often. And today, obviously, having the honor of having read your book recently. So congrats.
Thank you.
For that, we're going to talk about IBS in a very holistic approach with evidence-based, your methodology, your 4 pillars. But let's, get started. And I guess for the audience, just to set a bit the context, it would be great to talk a little bit about, okay, what is IBS for dummies? If we had to provide a concise and simple description.
Yes. So I'm so glad you asked that, because we use IBS, I think, a lot. And the amount of patients I see, they sign up to work with me and we go through and they've actually never even had a diagnosis, because we think that IBS is just someone gets a lot of bloating or someone gets digestive issues. And it is actually a very specific condition, but it is quite complicated to explain. So I'm going to explain it as simply as I can do in saying that it's a disorder of the gut-brain axis. What does that mean? So that means that the gut and the brain, they like to talk to each other. So if anyone's ever had butterflies in their tummy when they're feeling anxious or excited, that is your brain telling your gut something's not right. And that is your gut-brain axis. And it likes to talk together with the nervous system, maybe hormonal changes, microbiota. So there's lots of messages going back and forward. Now, when you have IBS, those messages don't work properly. So you might get digestive symptoms because you were a little bit excited about doing something, or perhaps you're a little bit stressed that day, or perhaps you're eating just what would be a normal meal, but it's fed your microbiome. So you have a little bit of gas in your gut, but you then experience that as maybe pain. So the symptoms really range from pain, discomfort, constipation, diarrhea, bloating, excess gas. So lots of digestive symptoms, but we can't diagnose just based on symptoms alone. And it is very much a chronic picture. So if you are listening to this and you've just had bloating for a couple of weeks, or you've had some discomfort for a couple of weeks, that's not necessarily IBS. You do need to have had it for at least 6 months. So it is a very chronic condition.
Well, that's a great overview, Kirsten. And, what I wanted to ask next, and something that really caught my attention in your book, is about, okay, IBS is in your head. It's not curable. It's hard to treat, right? And it's chronic, as you were saying. But as an IBS sufferer, I felt very identified. And I would just like to spend a few minutes talking about this emotional impact of IBS, because it seems to be also like a taboo, or we don't talk about it enough, in my view.
Yeah, absolutely. So I think people, because you go to your doctor, you should do, and you get these tests done, everything kind of comes back negative. And then because there is a gut and a brain connection, people start to talk about, oh, it's just stress, or you're over exaggerating it, you're thinking about it too much. And actually, it is very much real symptoms and a physiological problem in your body. But yes, the way it makes us feel is not good. And that's where we get into this cycle, don't we? So the irony is that stress and anxiety can trigger symptoms, but symptoms themselves are going to create this problem as well. And then even when they're not happening, we then start to worry about, well, when is the next time going to happen? You sit there eating your dinner, and even if it's not going to cause any issues, you're thinking you can't even enjoy it because you're thinking, am I going to get symptoms after this? Am I not? So it just really starts to impact every area of your life. And I just don't think unless you've had it, people really understand what it's like.
Yeah, I mean, it's like a bit of a chicken egg situation, and the anxiety kind of also adds more into the symptoms, and then it's really hard for other people to understand.
Yes.
I mean, even eating out, and actually on my wedding day, I was so anxious to eat. I barely could eat anything because I thought, okay, I'm gonna be bloated, and even a few days before, I did a low FODMAP diet actually. But yeah, it's just exactly emotionally quite hard.
Mm,
Um,
Draining.
next, I would love to now hear from you, Kirsten, about, okay, what are the challenges of diagnosing IBS? So you mentioned a bit, right, the criteria, or how we can diagnose it, but tell us a bit more about it.
Yeah, so that's part of the criteria. And if ever anyone wants to look up the black and white, exactly what that is, you can Google Rome, so ROME and IV, and it'll give you the exact definition for the criteria. But in terms of diagnosis, the issue is there is no IBS test. So for other conditions, you can go to your doctor, they run a test, you get that diagnosis because the test is positive. IBS does not have one specific test. Basically, there's a number of tests that should happen, and all they're doing is ruling out other conditions. So it does start to seem like, oh, it's the diagnosis you get when nothing else is found. And that's what makes people feel like, oh, it's not a real condition, it's just a throwaway comment. But it is a very much well-defined real condition. But the tests themselves is very routine. People think this is going to be complicated, but it's not. It's in every medical guideline, whether in the US, UK, Europe, Australia, it's all the same in terms of what we need to do to diagnose this. And it is a set of blood tests and then a stool test just to rule out other conditions like celiac disease, which I actually have. I'm blessed with both celiac and IBS. But celiac disease is an autoimmune condition. It impacts 1 in 100 people. They think maybe more. And the symptoms are identical to IBS. So people go and they think, oh, there's nothing wrong, but they have this test and actually have celiac disease. So they need to have that ruled out. And one of the issues with that is to have an accurate test, you need to be eating gluten. Now, you only need to Google or go on social media, and we're bombarded with these messages about don't eat gluten for gut health, which is incorrect, by the way. But a lot of people, by the time they reach out for help, they're already on a gluten-free diet. So trying to get that accurate test is very difficult with that. So it can be, and then there's the taboo. So often people go to their doctor, and you've got maybe 5 minutes with your doctor, and you don't really feel like exactly telling them exactly everything that's going on necessarily. So there's quite a few barriers there, I think. But all I would say to anyone who's worried is these are really routine tests. This is not even something you need to see a GI or a specialist doctor for. This is just your GP, run of the mill, everyday testing. And honestly, talking about poo to them is literally like talking about the wallpaper color. Like that, it is so mundane to the point, like even me and my friends who are dietitians will talk about this over dinner. Like it does not impact us at all.
That's I love that, Kirsten. It's funny you mentioned this, and I'm glad you do. Right, it's still a taboo. Many people are embarrassed to share that, even with a GP. But it's very encouraging what you say, that it's low barrier. GPs can run the tests, and something I found really interesting about your book is that you also mention the tests we should not do because they might not have the credibility or evidence. Could you tell us a bit more about that?
Yeah. So basically, most of the tests you'll see on social media, where and so anything that your GP says they don't do is got no research behind it, and it's actually a fad. So I'll go through some of the most common ones, but you can guarantee if the NHS is not doing it, that's because there's no because the actual test you need to be done for IBS is very cheap. They're very basic. So these is not the NHS is not trying to avoid doing some tests. There's no research behind them. Anyway, so food intolerance testing is the first one I see all the time. And there's a whole range of ones like hair testing. The most common one is this IgG testing, which looks very sciencey because you think, oh, look, they're looking at antibodies. That looks legitimate. It's also tends to be quite expensive. And you send away a blood sample and they send you a report back with like literally hundreds of foods about how you're intolerant to them. Now, there is unfortunately no way to diagnose a food intolerance via test at the minute. So that's completely inaccurate with that one. The other one we're seeing at the minute is a stool testing. So you'll send away a stool sample and they look at your microbiome. And the issue we have at the minute with that is we don't actually know what a normal microbiome looks like. So even if you did have an accurate microbiome test, what are you going to do with that? You can't, you can't say, oh, you need to eat more of this or less of that. We don't know what you're aiming for. And a lot of them will try to diagnose things like candida, which is a type of fungus. And really, I mean, in 13 years of working in gastroenterology, I've only seen 2 candida cases because it's so rare to have actually an overgrowth in your gut and causing an issue. One person had end-stage HIV, so they're very unwell, these people, and somebody else was on chemotherapy. So again, very unwell. And the only way to diagnose that is through an endoscopy. So you definitely can't diagnose it for a stool test. So there's honestly countless tests out there that claim to do different things than actually. And I think probably the latest one, which is not so much of a fad test, but it's more of a grey area, is SIBO testing. So often when we get that IBS diagnosis, we're not really given any help. So we feel like we've tried it all. Often people will say they've tried probiotics, the low FODMAP diet, etc., and nothing is really working. So then this other potential diagnosis pops up, SIBO, which is small intestinal bacterial overgrowth. And there's various claims about this online. So you can actually buy the test privately, but the issue is the test itself is not 100% accurate. And you would need a GI consultation, so a specialist doctor consultation alongside it. So it's a quite a complicated diagnosis, but people are being almost conned into going, oh no, I'm just going to pay for this test for £100, £120 to get that diagnosis. But actually you can't use just the test. So just a few common ones I'm seeing just to be aware of.
And that's very helpful, Kirsten, because I'm sure a lot of people, I mean, even personally, right? We spend money on this and we don't get anything out of it. It's not accurate. And as you say, right, then we still need to find help. We are on our own pretty much all the time.
Exactly.
Yeah, yeah. Next point, actually, I would love to speak about tracking and symptom monitoring. And here I have to say a big shout out because you were so kind to mention Sano on your book. I was reading it and I didn't see, I didn't expect it. And then I'm like, whoa, we are here. It's amazing. But to your point about how tracking can help anyone with IBS, yeah, I would love you to expand a little bit more on that.
Yeah, absolutely. So tracking, we've got to be careful with because again, so many people listening to this, they'll have tracked, they're being told by their doctor, go and keep a food diary and see if you can figure out what the cause is. Now, the issue is when we're tracking symptoms, if you have symptoms today, that might be because of what you ate at breakfast. It could be because of your stress. It could have been because you had poor sleep last night. It could be the amount of food you ate, the combination. But all you are trained to do from the offset is look at that one food and go, oh, it must be that food. So you take it out of your diet. And what we then tend to see is people end up almost with like a disordered eating because over time they're just taking out one food after the next. Because every time they get a symptom, they think, oh, it must be that one food. And actually, it's more complicated than that. So tracking can be useful when it's done correctly. And this is what I talk about a lot in my book. And what we do in the book is we teach people how to track it. So to start to look for patterns. So look to see actually what is the different factors in that day. Does it happen again? So we start to get a few more answers that way. And tracking is probably not so useful for pinpointing triggers, but it's very useful for pinpointing or identifying habits, I would say. So when you start to learn about different nutrition elements, so for example, just like fiber, maybe tracking, you'll start to say, actually, my fiber is really bad. No wonder I'm not opening my bowels, regularly, or perhaps there's days where I'm actually really stressed. Now that's going to highlight something to you. Okay, now I'm going to just focus on my stress. So it's more useful, I think, in my opinion, for people when they're not getting that direct help from a dietitian to track it for them, to look for areas where they can start to concentrate on rather than actually pinpointing very specific foods and taking it out.
Yeah, and I'm glad you mentioned that, because tracking, and as you said, right, if brought to the extreme, can be a bit too much, and some people can take it to the next level. I mean, something that we do at Sano is, if someone comes like on their own without a dietitian, typically it's a 2 to 3 day tracking, also because there's a bit of personalization into that. But then always we refer to, okay, look for help and look for professionals like yourself. Yeah, definitely. So, okay, now we know a bit about what is IBS, all about the diagnosis. Be careful with some of the tests out there, the emotional impact, the importance of tracking. How about you explain us the 4 pillars you mentioned in your book? And I'm sure we could spend so much time, because I loved all the holistic part, but could you give us a quick overview about what the 4 pillars are about?
Yep, sure. So I've come up with the 4 pillars because I found that if we just look at one area in IBS, IBS is very much a puzzle. So we need to look at all the pieces of the puzzle rather than just one or two pieces. So number 1 pillar is nutrition, which does not come as a surprise. I'm a dietitian at the end of the day, but nutrition in 2 ways. So number 1, actually, is there any triggers? And for some people with IBS, they don't have any dietary triggers, which often surprises people, but clearly identifying, and normally we're able to do that using the low FODMAP diet process. The other more important part of the nutrition element is actually getting into a diet which is very good for the gut health. So looking at variety, looking at the amount of fiber, looking to see if we're actually having excessive amounts of things like caffeine, alcohol in our diets, meal timings. So all these other things are really creating an environment where the gut can thrive with nutrition. And that will help reduce the sensitivity over time as well. So that's really important. Number 2 is looking at sleep. So the sleep really impacts gut function in a number of ways. So there's research, for example, to show the number of night waking, so how often somebody wakes up overnight, can actually directly seems to be linked to the amount of days that someone has symptoms that week. So it's really linked. And again, no one ever talks about it. It's always about the mental health, potentially is now becoming more of a big topic, and then the diet, but sleep, the quality and the quantity. So is somebody getting that crucial 7 to 9 hours of sleep? I always say a minimum of 8, because we do wake up overnight. It does take us a little bit of time to get to sleep. And is it consistent? So looking at that sleep hygiene before they're going to bed, are they going to bed at the same time waking up? And a lot of these things are actually more achievable for somebody with little help compared to doing something more complicated than the low FODMAP diet. So sleep is a really important one, and often a bit of the low hanging fruit that somebody can manage on their own, maybe. Mental health is the next one. So mental health, as we've already covered in the gut brain axis, it really impacts the gut. Now, some people we know with IBS, IBS is more linked to anxiety and depression. So they might have a diagnosable mental health condition, which is not uncommon, unfortunately. But it could just also be that they have now and again have anxiety or have a really stressful environment at work, and that will also negatively impact them. So we need to acknowledge that. And depending on the person, it could be something like meditation actually improves how their gut brain axis works and the mental health works. Some other people actually need to use things like low dose antidepressants, which we know impact the gut brain axis very well. Some people might need therapy. So cognitive behavioral therapy is very good. So there's different avenues. And again, it's all about that personalization, really. And sometimes we use a couple of things. So often my clients might have CBT, but they might also be doing meditation every day. So it's not you have to do one or the other. And then finally, looking at movement. So I use movement rather than exercise as a term, because I think when we use exercise, people think they need to be up at 5 in the morning doing CrossFit, which is fine if that's your thing. But for the majority of us, that's not going to be a great idea. And movement is just about trying to move every day, at least 30 minutes. It could be that you go to the gym 3 times a week and do something more intense potentially. But the other days, what are we doing? Go out for that lunchtime walk, go and do some gardening outside, walk around London if you live in London, even if it's cold. So you just need to get moving on a regular basis. And we've seen multiple studies show that this improves gut function. So really looking at the whole picture.
Well, I love what you said about IBS is like a puzzle, right? And we got to figure out, okay, all these pieces coming together and what works for each individual. We are all different. But I absolutely love it. This holistic approach is really missing out there, isn't it, Kirsten? I mean, in the public healthcare system, even in private pathways, I just still struggle to understand why it's not covered for IBS.
Yeah. Yeah, I think to be honest, the issue is just I like dietitians were always like, I think being told historically to stay in our box of just diet. So obviously, even not just in IBS, if you look at weight loss, if you look at PCOS, fertility, other areas of dietetics, that it still includes these factors. So I think it's just improving that. And interestingly, we're actually in the process of rewriting the British Dietetic Association guidelines, and I'm part of the group that's adding in the non-dietary part. So that will be an exciting development.
Wow, that is super exciting. Yeah, I can't wait to. Can you share more or less when are we going to have like revisited guidelines then to introduce this holistic approach?
Yeah, so we're looking, I think, next year, but with anything, there is so many people involved, and then it has to go. It's a quite a rigorous process to get the best research, and some of these areas don't have a lot of research behind them, so we're having to, at the minute, send out questionnaires, getting people's opinions back and things. So it's a very rig. So this is part of the issue. It needs to be very clear, concise, and accurate, but at the same time, that also takes a lot of time. So we're hoping next year. And I think it's because I don't think people understand guidelines. It really drives even what people are taught at university, how we get funding for more dietitians. It's really important.
Yeah, it is. Wow, very exciting. And so you mentioned, right? I mean, the different pillars, and I would like to zoom in a little bit more now on the mental health piece. And this is actually a big one. We through the platform, we have been receiving a lot of questions as well about, okay, what does it really mean? Like IBS and mental health. You touched upon anxiety, depression, even eating disorders. So could you share a bit more, any numbers, any research, and any more details on this pillar specifically?
Yeah, so the research is difficult, it's quite grey, unfortunately. But we definitely know that people who have got IBS is more common to have depression than the general public. We know that people with IBS and depression, the depression is more severe than somebody who doesn't have IBS. So again, that's a big connection. So it seems to be linked. And interestingly, we know that people who have got depression, anxiety, when we look at their microbiome, that it is different to somebody without. So that's a potential link there. But it is very much potential links, and it's just a little bit grey. And to be honest, in some ways, as much as that's frustrating for people who really love the research, because we like hard cold facts and figures, in a way it doesn't really matter. As long as we're really aware that people with IBS are actually more susceptible to these mental health conditions, that's the main thing, so that we know then what treatments to put in place, I think. But interestingly, it's thought that potentially people have got like this genetic predisposition to some of these things. So potentially, because if you look at why people get depression, anxiety, you might have 10 people who are put through the same life, same experiences, and only some of those get at depression, anxiety, not everybody. And it seems to be really similar with IBS. So it could well be that again, it's something to do with the gut and the brain disorder, not functioning quite well. So hopefully in the future we'll have more research, because I know there's things like probiotics going on to potentially actually directly impact depression, but we're not at that stage yet to say, oh, if you take this probiotic for depression, it's going to help. So it is a tricky area in terms of understanding it, but I guess the treatment bit we do have lots of research on. So we know there's loads of randomized control trials on clinical on cognitive behavioral therapy, which actually targets an IBS, the gut-brain axis. So before I wrote my book, which came out in March, I actually used to think that this was to do with if somebody had depression or anxiety, they would go for CBT to help with those conditions, but that's not true. It's actually used for specifically for IBS. So if you've ever had CBT before, maybe you thought, oh, it didn't work, it's probably because you had the wrong type of CBT. So there's lots of things like that which are useful.
Interesting. That's a very interesting point, actually. But yeah, we are in the early days, right? There's so much we don't know yet. But as you said, the important part is that we kind of know there's a connection there, and we got to be aware of that. Um, and basically, so what we did is to ask our audience about, okay, what are the questions that they would like to ask you? And basically, very, very interestingly, the most popular points were about debunking myths around IBS. So
Yes.
we tried to group them, and we found, like, for example, well, two main categories that came up were about, okay, restrictive diets, and especially about elimination diets. You referred a little bit to that before. And the other big area, surprisingly enough, was fasting. And basically coming from a cohort saying, hey, I feel like maybe if I stop eating, or I do fasting in the morning on that window, I feel like I'm more, yeah, I clean out my stomach, and I'm a bit better in terms of IBS. Is there any evidence around that? What are your views on these myths?
Yeah. So let's address the fasting one first, because I think that's easier to address. So with fasting, yes, somebody might feel better initially because their gut's not doing anything. You've got nothing in there going on. But we know from research that actually eating irregularly, so not having a regular breakfast, lunch, and dinner, actually worsens symptoms. And this could be for a number of reasons. It can be that your energy levels drop, it can impact mental health, but it could also be that you just don't have enough fiber if you're only eating 2 or 1 meal per day. So fasting is not recommended for IBS at all. In terms of elimination diets, this is a really broad term, and it kind of just means eliminating something. So that could be really restrictive or not. The only one that's got really over 10 randomized controlled trials, it's really well researched, is the low FODMAP diet. But it is often used in the wrong way. So the low FODMAP diet is a diet which is low in fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. Bit of a mouthful, but basically these are carbohydrates that can cause symptoms in some people with IBS. Now, if I could go back in time to the researchers in Monash University who invented this diet, I really wish we wouldn't call it a diet, because it's actually a process. So the way we are supposed to use it is you avoid these carbohydrates for around 4 weeks, and then you do like a systematic reintroduction, which then diagnoses what you're intolerant to. However, because we have coined it the low FODMAP diet, people are often put on this diet for months, years, and they're told that it's good for your IBS. And actually, it's not good for IBS at all. If anything, it actually reduces the levels of good gut bacteria. And we know it can lead to more restricted eating behaviors. We know that potentially it reduces things like calcium intake, so it can cause other issues. It is literally only a very short diet as part of a longer process. So it's not good for gut health. It's just a way to diagnose food intolerances.
Wow, I never thought like that it's basically the Monash or the low FODMAP diet is actually a process. So I really like that one. Um, we'll add this as main quotes on the episode. But super interesting, Kirsten, and thanks a lot for clarifying, right? There's a lot of misconception around this out there. And probably what doesn't help either is that we see in social media a lot of influencers, or just people who do fasting, and out of a sudden they say that it might help with IBS, but actually your point about routine and our gut liking a clock, right? That makes so much sense. Right. And is there any other myth that you, for example, you hear in clinic with your patients? What would you highlight? Any
So
myth?
probably the biggest one is gluten. So it's gluten is not a trigger for IBS. And this gets repeated again and again. Everybody's tried gluten-free diet. And what it is gluten, a lot of the foods where gluten is, like your bread, is also containing FODMAPs. So gluten is only a protein. So unless you've got a gluten allergy, which I've not seen in 13 years and working in gastroenterology, so this is very rare, or you have celiac disease, which you should have been tested for as part of your IBS workup, you do not react to gluten. Gluten is absolutely fine, but you might have a certain tolerance level to the fructans, which is the type of FODMAP in these foods. So yes, if you avoid some gluten foods, you might feel better, but it's because of avoiding FODMAPs. So people come in and they're eating things like gluten-free oats, which you do just have normal oats. You don't need to have that level of restriction. Or they're buying all gluten-free products, which can be actually quite expensive, and they're often highly processed foods. So you can enjoy things like sourdough bread, which is low FODMAP, but it's got gluten in it. So I would just say, I'm celiac, so I have to eat the rubbish bread. Everybody else doesn't have to do that. Enjoy sourdough bread. And really, I think with the low FODMAP diet, what you can do is actually then identify how much you can have, because you do not have an allergy, you do not have an autoimmune condition. You'll still be able to have bits, maybe just not a lot, but it's not the gluten causing the issue.
Good point. So it's more about understanding the thresholds,
Yes.
and not that about eliminating completely the gluten. Yeah, good point. And Kirsten, you mentioned before that, I mean, to be honest, you're such a pro in the space, also with your latest book, leading the task force also for the IBS guidelines in the non-dietary part. How do you see then IBS care in the next 5 to 10 years? Um, I hope you're positive, but I know we have a long way to go. What's your view on this?
Ugh, very good question. So, what I hope to see is more people specializing in it, because I think it's very difficult to treat IBS when you've got one person just looking at one specific area. So, I hope to see more people, more dietitians like myself, and there is a good few of us, but who have got the experience and they understand the psychology, they understand the movement, they understand the sleep. That's not to say that, I will be sitting clients through therapy sessions, because, of course, we have our limitations. But I just really hope to see that. And what we are starting to see in the NHS, and which actually saves the NHS money, which so it should be in every GP practice, is first line dietitians who specialize in gut disorders. So they sit in the GP practice. If someone comes in that with digestive problems, they would see a dietitian rather than seeing their GP, and that dietitian has got more time with them. They're obviously very specially trained, but it actually helps the NHS. It saves them money. It stops them going to see the GI doctor who doesn't know what else to do with them in those scenarios. So I'm really hoping that there's going to be more research and funding for these kinds of roles, really, to help people.
That would be amazing. So more training, specialization, and more holistic, no, and bringing this into primary care. I mean, the prevalence of digestive disorders, not only IBS, is quite significant, right? So I would presume there is also a business case for example, NHS to take that into account.
It's very tricky, to be honest. I wasn't in the NHS long enough to understand these business cases, but the problem we have, because I remember seeing a study maybe 10 years ago now showing that having a dietitian in GP practices saved the GP practice £30,000 per quarter. So that's a significant amount of money. So it's not even just we're trying to improve care, it's actually saving the money. So in my mind, that's a no-brainer, right? And yet most GP practices don't have this service. So there's a lot of internal politics. I think, there's a lot of focus on the kind of the buzzwords now, like obesity, diabetes, mental health. And I know these areas also deserve attention. That's not what I'm trying to say. But I think IBS is just, we need to make more noise, unfortunately, to really get that attention, and things like the guidelines and, dietitians actually doing more research to show how big an issue it is. And the psychologists and other people involved in this area is really going to help in the future.
100%. Well, let's make more noise about it. And Kirsten, I could spend a long time with you talking. This is such a master class in my view. But one of the questions I love actually, and I ask all my guests, is what do they do? What do you do on a daily basis to take care of your gut health? And I'm very curious because as an IBS and celiac sufferer, I can't wait to know. Yeah, what do you do to take care of your gut health?
Yep, good question. So I have to say I practice what I preach. And I have done the full low FODMAP process. I'm kind of like the other side. So I've come a long way. So to kind of maintain that control, I've noticed my biggest things are stress and mental health, I'll be honest. So I also suffer with like generalized anxiety disorder. So my biggest things are actually quite basic in some ways, but getting enough sleep. So if anybody wants to hang out past 9 p.m., like they can't get hold of me. I'm like winding down, my phone is switched off. I'm pedantic about my sleep. My husband gets annoyed. He's like, "You're like a 90-year-old woman." I was like, "But no," because then I know the next day I just can't function. My gut goes downhill. My food choices change as the sleep for me. Water intake, again, I will always stay hydrated. I'm not going to share exactly how much I drink because it's very specific to the person. But again, I have a huge bottle of water I take around with me, and I know that's going to help. And then the other thing is meal planning. So I plan my meals, and this is probably something I picked up from my mum, to be honest. So all those years ago, she was leaving something with me. But I know how busy I am. And if it gets to midweek and there's nothing in and you're hungry, the last thing you want is like to sit and cook and things like that. So I'm all about the quick meals, being realistic, but I plan my entire week in terms of food. So those three things, um, they save me time. They save me going to any kind of like bad places mentally or with my gut function. But I'd say if you're in the start of your journey, I have to say it might be a bit more complicated. But once you get good control, you can do that good control with doing a few basic things like that just to stay on track. You don't have to think about it all the time.
Those are great tips, huh? I mean, and the meal planning, I was just thinking, right, the importance even of batch cooking or right, so to have that
Yep.
structure and just having the week ahead covered. Equally the sleep and the stress management, right? And hydration. Really
Exactly.
good points. Yeah, well noted. So, Kirsten, in terms of final remarks, I would love you to share a bit more about your book because, for me it's been really, really helpful and it's become a bit like a toolkit. Every time I feel like, okay, now what about my sleep, right? Or about all these tips that you go there. Um, you have a structure with the pillars and can you tell a bit more then about your book, how people can find it and find you?
Yep, thank you so much. So yeah, the book came around through frustration, I'll be honest, because just like you've kind of touched on already, there's so many people being diagnosed with IBS. 1 in 10 people have this, and no one's getting any help. Yes, we have some dietitians in the NHS, but it's very limited in terms of service, and not everyone's going to be able to afford private healthcare. So there was a real niche there, a want. Someone can pick this up for around £12 or even cheaper if it's on Kindle, which is very accessible for most people. And then I noticed there's already lots of IBS books out there. So why would you need to write a new one? And even though there's lots of IBS books out there, most of them have been written by doctors who don't actually manage IBS. So in terms of the practicalities and things, the way it's written, it wasn't very practical. It didn't give you all the little ins and outs and details. Or they're on lots of low FODMAP diets. There's loads of low FODMAP diet books, recipes, and some of them are really well written, but it's only one piece of the puzzle. So I really wanted to produce this book, which is literally like the Bible for IBS. And it's good for anyone who's just been diagnosed, anyone who's had it for 20 years. It doesn't matter. And it goes through everything step by step, but there's also practical things in there. So things around like that you probably wouldn't expect, like things around dating and, being intimate with your partner. That advice doesn't come from me, you'd be pleased to know. We interviewed a pelvic floor specialist, so it keeps it really sciencey. Or travel. So it's not just another low FODMAP book. It's got everything. It's got all of the medications in there and how to take them, when to take them. We had gastroenterology input for that. So it really is fully comprehensive from start to finish. And anyone who wants to purchase it, you can get it on Amazon or in any bookstore. So it's in Waterstones, Foyles, all the big bookshops as well. And it's in the US, UK, and then also Australia. And hopefully we'll get it translated next year or so. So yeah, very exciting. Leave me a feedback if you get it. I'd love to know what the feedback is. And in terms of finding me, I actually just launched my new website today. So it's theibsdietitian.com, or you can get me on Instagram, which is the.ibsdietitian.
Wonderful. And the name of your book is Take Control of Your IBS.
Yes, good question. Should have led with that. It's called Take Control of Your IBS, the step-by-step guide that actually works.
Awesome. But I mean, what you were saying is truly is totally right. It feels like this, Bible or kind of way to have all the information in one place. And as you said, all these tips and actionable insights about even, you're in a very intimate context, right? And you're just worried because you're passing gas all the time, right? Or things like that. I'm so glad, Kirsten, you wrote this book and thank you for all the amazing work you're doing for the, IBS space and gastroenterology in general. So it's been an honor to have you here. Really, I mean it.
Thank you so much for having me.
Well, let's keep in touch, Kirsten. All the best.
Okay, speak to you soon. Bye.
Bye.